Sarah. I'm the physician assistant student who's going to be conducting your exam today. Before we get started, can I just verify your name and date of birth?
Yeah, Paul Bartlett, 7/22/53.
Okay, great. And then do you prefer to go by Paul or Mr. Bartlett?
Paul's good.
Okay, and then before we get started, I want to make sure that you're okay with me taking care of you today since I'm still a student.
Yep.
Okay, great. I'm just good. I'll just sit down here. Okay, so what brings you in today?
I'm having a lot of chest pain and then trouble breathing.
Okay, can you tell me a little more about that?
So it's happened before. I've felt this way in the past, but it's worse this time than it ever has been before. And I was just eating dinner with my wife and started being short of breath.
Gotcha. Okay. And then so when did this chest pain and the shortness of breath first start?
I was eating with my wife just like a few hours ago.
Okay. And then are you able to show me where it's located? Even if you just point to it.
Yeah, just like right in here.
Gotcha. And does it radiate or move anywhere else at all?
No.
And then how long would you say this episode of pain and shortness of breath has lasted?
It's been going on since like a few hours ago. Just
Okay.
It hasn't really changed since then.
And is this different than any of the past episodes you said you had?
It's just worse. It's more intense pain, but not really much different besides that.
And then do you feel like the pain has changed over time or has it stayed pretty constant since it started?
Stayed constant.
Okay, thank you. And then how would you describe the pain? Do you feel like it's more burning, sharp, throbbing, or stabbing? Even a scratchy pain?
I would say sharp.
Great. Have you tried anything that's been making the pain or shortness of breath worse?
Well, my wife insisted on calling an ambulance,
Mm-hmm.
so that's how I got here.
Okay.
And they gave me nitroglycerin
Okay.
in the ambulance, and it helped a little, but that's it. That's the only thing I've tried.
Have you taken anything in the past for the other episodes you've had?
No.
Okay. Have you, has walking around, standing up made the shortness of breath worse?
Yeah, it gets worse when I move.
Okay. And then does laying down make the shortness of breath any better at all?
No.
Okay, thank you. And then have you tried any over-the-counter at home remedies for any of the pain? Okay.
Mm-mm.
And have you noticed any associated symptoms besides the shortness of breath and the pain? Any headaches or dizziness, nausea at all?
A little bit of nausea.
Okay. Nothing else, like any fatigue or anything like that?
Yeah, I would say I'm a little bit tired.
Okay, thank you. And then would you say the onset of the pain and shortness of breath was gradual, or did you feel like it happened all at once?
I would say more all at once.
And then have you noticed the onset of it come on with anything when you're doing more activity, or is it just pretty random and sporadic?
I'd say it seems pretty random, and it's been happening on and off for a long time. This one episode's just been a few hours, but there's been other episodes, and those episodes have been happening more frequently recently.
Okay, thank you.
But I wouldn't say anything seems to cause it directly
Okay.
that I know of.
And then 0 being no pain at all, and 10 being the worst pain you've ever had, where would you rank yourself right now on severity?
Maybe an 8.
Okay, thank you. We'll see what we can do about that. And then, is there anything that you're worried or concerned about with the chest pain and the shortness of breath?
Definitely a heart attack. More my wife is worried than me, but you know,
Okay.
I'm here because she wants me to be here.
Right. And then what are your expectations with treatment? Is there anything in particular you'd like me to pay a special attention to or help you with?
Not really, just figuring out what's up.
Okay, so now I'm just gonna ask questions. I ask all my patients just to get a good understanding of your past medical history so we can figure out what might be causing this.
Okay.
Do you remember any childhood medical conditions you've had?
No.
Okay. That could include like any cardiovascular issues as a kid, asthma, anything like that.
No, not when I was a kid.
Okay. And then do you have any current active medical conditions?
Yeah, so I have hypertension and
Okay.
COPD,
Okay.
and then I have coronary artery disease.
Okay. Can you remember any inpatient stays you've had in the hospital or any surgeries that you've had?
Yeah, so I had a stent put in
Okay.
in 2007.
And were there any complications with that? Did it go okay?
It went fine.
Did it seem to make things better?
Yeah, I think so. For a while, but it's been a long time.
Okay, thank you. Are you on any prescription medications right now?
I take albuterol for my COPD,
Okay.
and then I take some hypertension meds, but I'm not sure what they are right now. But my wife has the list, and I can
Okay, yeah, I can talk to you
have her
about it.
get that for you.
Do you remember how many times a day you usually take the albuterol?
It's just whenever I need it, but I've lately been probably taking it once a day.
Okay. And is it an inhaler?
Yep.
And then are you on any over-the-counter medications or herbal medications?
No.
Okay, thank you. Are you aware of any allergies that you have to any medications?
Nope.
And then have you had your Tdap shot, and then there's a bunch of childhood shots such as MMR, varicella, and pneumonia shots?
I should be good with all of that. My wife keeps me on
She
top
keeps
of
you.
it.
And then, have you had a colonoscopy recently?
Yep.
Okay.
Well, not recently, but I'm within the 10 years still.
Okay, great. And then, do you get your blood drawn regularly? Do they check for like lipid panels and different things like that?
Yeah,
Okay.
I think so.
And then have you had a prostate exam?
Yep.
And then do you remember if you've had the pneumonia vaccine specifically?
I think so. I could call my doctor and find out.
Okay, we can double check on that for you too. Okay, now I'm just gonna ask you questions about your family in general too, so we can see what common patterns might be in your history of illness.
Okay.
So do you remember if your parents or grandparents have experienced diabetes, strokes, cardiovascular disease, heart attacks, high cholesterol, hyperlipidemia, anything like that?
My dad died of a heart attack.
Okay.
He was 85. No, he was 45.
Okay.
My mom didn't have any heart problems, and I don't think any of my grandparents did.
Okay.
But my brother also had a heart attack.
Okay.
He was 57, and he survived.
Okay.
He's still alive.
Do you have any other siblings?
No.
Okay.
Just
And-
him.
And then do you have kids?
Yeah,
How many kids do you have?
3.
Okay. Do they have any problems with like heart problems, like cardiovascular disease or anything like that? Okay.
No,
Do you have any family history of diabetes or stroke?
I don't think so.
Okay. Go. And now I'm just gonna ask you some more questions in general, just about yourself. Can you tell me about where you live right now?
Yeah, I live with my wife.
Okay. Do you live with your kids too, or they're all moved out?
They're moved out, just her and I.
And then, what do you do for a living? Are you employed?
I'm actually retired.
Oh, that's awesome.
Mm-hmm.
What did you do?
I was a construction worker.
And then have you, in the past, or do you currently use any tobacco products? This can include like chewing tobacco or smoking.
Yeah, I smoked for a long time, for like 30 years, but I quit 5 years ago.
Okay, that's awesome.
Thank you.
And then have you in the past, or do you currently use any recreational drugs?
No.
Do you drink alcohol at all, or have you in the past?
Yeah, nothing crazy, nothing super regular. Maybe a couple times a month I'll have a drink or two.
Okay, do you usually drink beer or liquor or wine?
Depends on the night. I'd say beer more regularly.
Thank you. And then have you traveled at all in the past 6 months? This can be out of the country or even locally.
Nope. Just hanging out.
And then do you feel like you're under a lot of stress at all, and do you find you have ways to cope with it?
I don't think I'm under too much stress. I have
Okay.
a pretty easy life. My kids have some issues that sometimes, gets me
Right.
thinking, but overall, I'm pretty good. My wife and I, we can talk and,
Yeah, that's awesome.
I have some support, my brother too.
Sounds like you and your wife take great care of each other.
She takes good
Yeah.
care of me.
And then can you tell me a little bit about what you usually eat in a typical day?
Maybe an egg and some toast in the morning.
Okay.
And then, I don't know, just whatever I can get my hands on, honestly, around lunchtime.
Okay.
Maybe that's a sandwich or, I don't know, some chicken or something.
Okay.
But it also could be fast food, depending on the day.
Mm-hmm.
And then for dinner, my wife cooks really good food. It tastes, she's a wonderful cook.
Yeah.
I don't know, fried chicken is my favorite. Spaghetti.
Thank you. And then
Depends on the day.
do you usually exercise during the week?
I do what I can, but nothing crazy. Her and I will go on walks around the block.
Okay, that's
once in
awesome
a
that you
while.
guys are able to do that. That's really awesome.
She takes good care of herself.
Okay, and now I'm just gonna move on to asking you specific symptoms that you might have had in the past 6 months.
Okay.
So just starting out, have you noticed that you've had any fevers or chills?
No.
Have you woken up with any night sweats or had a recent weight change?
I'll sweat a little bit when the chest pain comes
Okay.
and goes. Nothing crazy. This time though, I'm sweating like crazy.
Okay. Have you noticed a recent weight change at all?
No.
Have you noticed fatigue or weakness?
Fatigue, maybe a little bit of weakness, but nothing crazy.
Okay. And then have you noticed you're coughing more than normal?
No.
Or at all? Okay. Have you noticed any like blood or anything like that in your throat?
Mm-mm.
And I know you said you felt short of breath. Do you feel pain at all when you breathe?
No pain.
Have you noticed any wheezing?
No.
Okay. Thank you. Okay, and then I know you said you have hypertension.
Mm-hmm.
What's your normal blood pressure, would you say? Have they been higher than normal?
I don't really check it
Okay.
at home. I think my normal is about like 120/80 with the meds that I'm on, but I haven't checked it.
Okay, so you feel like it's controlling it well?
I think so. I don't know about when, like right now when with the pain
Right.
and everything. Maybe the ambulance took my blood pressure, but yeah, I don't know. I'm sorry.
No, that's all right. We can check on all that too. And then you said you've been having chest pain. And then have you felt like your heart's been beating irregularly at all?
No.
Okay. Have you noticed any murmurs? So maybe not beating fully.
No.
And then have you noticed that you're short of breath even when you sit down?
Yeah.
Okay. Are you short of breath at night?
Not any more than normal.
Okay. And have you noticed any swelling in your legs or arms?
No.
Okay, thank you. And then have you noticed any pain in your legs at all?
Mm-mm.
Have you noticed any cramping?
No.
Okay. And have you noticed any skin or color changes over your arms or legs? Have you noticed any varicose veins or ulcers?
Mm-mm.
Okay. Sorry, I know this is a lot. We're just trying to make sure we get a full picture.
I appreciate it.
Okay, and then have you had any joint pain or swelling? Have you ever had any neck or back pain?
Mm-mm.
Okay. And then do you have arthritis at all?
I don't think so.
Thank you. And then have you noticed yourself feeling anxious at all or depressed?
No.
Have you had any problems with sleeping?
Mm-mm.
And then have you had any panic attacks or anything throughout your life?
No.
Thank you. And then one more set. Have you noticed yourself being dizzy at all?
Maybe a little.
Okay. Have you noticed any weakness or numbness?
Mm-mm.
And then have you experienced any headaches? Okay. All right, Paul, well, thank you so much for letting me see you today.
Thank
I'm
you.
gonna review all this and then we'll get back to you.
Okay.